So we finished treating him, treating his whole body, and his hip internal rotation increased by about 5 degrees, and now it has a soft end feel. Maybe it increased by 10 degrees. I don't think we're going to gain equal to the left, but I'll take whatever I can get. And in terms of his pelvis, it now appears to be much more symmetrical. Little bit of subtle asymmetry. I can now push it to a stop point, that's called taking up the slack, and then I can spring it, and now we have motion translation through the pelvis. Let's have you line your stomach. I'm going to check that camera angle. Okay. So before we treated, we didn't have any inferior glide motion here, and now I can take at the slack and I can spring. And the motion translates through the SI joint into the hip and into the lower extremities. The lower pelvic asymmetry is much improved. Those look almost symmetrical. More importantly than how they look is that we have restored mobility in this direction. And that motion is improved on both sides, and it now springs the other direction, going to the left as well. Okay, so I'll change the camera angle, and then I will show the change in symmetry. All right, so his pants seam matches his gluteal crease. And now you can see that there's significant improvement in the symmetry of the sit bones. I'm now testing the sacrotuberous ligament. It's right here, and now I can indent that ligament. So we've restored normal tone of that hypertonic sacrotuberous ligament. We also mobilized his rib. And now that mobility is improved. And we tractioned his atlanoaxial joint, the C1, C2 upper neck joint. Let's have you lie on your back, please. And lift your head up. All right, so now when I come beneath the mastoid process, there is a deeper sulcus. And I hit the transverse process of C1, and now I can easily glide it to the right. I can easily glide it to the left. When I come underneath that C1 segment, I can easily induce rotation now. And before, I was able to take up the slack, but I wasn't able to then impart any traction after that. But now you can see the traction mobility. And then we'll retest that in extension. And so now his neck is in 10 degrees of extension. I can now take up the slack. I see movement translate all the way down to his feet. And then I can add additional force, and that traction force translates through his whole body. So I'm pleased with the motion gains that we've achieved. And in the next video, I'll show you how I accomplished that.